Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome everyone back to another episode. Today I'm with Dr. Roger Levin, the founder, CEO of Levin Group. Roger, thank you for joining us again.
Grant, this is great. I'm so excited to be doing part two and helping our office managers go to an extraordinary level of performance and become chief operating officers running the practices. So this is really fun for me.
Yeah, I loved our first episode, the last one we did, where we were kind of discussing that role of the office manager being that kind of chief operating officer, setting up systems, and just kind of a different mindset, I think, than most are thinking of for a manager. And I thought it was excellent. So definitely recommend our listeners review that one if they haven't already listened to it. So today we were going to talk a little bit about building the team around the manager. What are your thoughts on that one?
Well, one of the major roles of an office manager is to manage the team. So as we jump in, let me give a quick review for anybody that missed part one. I'm not going to redo part one, but the objective is for your office manager to become your chief operating officer. And that means, in very simple language, they run all non-clinical aspects of the practice. It's the only way surgeons can get freedom to spend more time with their patients, focus on their clinical skills and their referring doctors. So this is one of the greatest opportunities, and it's also one of the most missed because 96% of dental office managers don't have a management education or background. Now, having said that, there are many hardworking people out there. I respect them. They just need new skill sets and training to master the job and take more and more off the surgeon's back and make sure things get done. So as you said, Grant, one of the major roles is human resources. Oral surgery is a business, and every business, unless it's robotic or online, meaning AI type of businesses, depend on people. And of course, AI has people behind what we see online. And I think every day, every hour, part of the role of the office manager is who is on my team? What are they doing? Are they doing it well? Can they be better? What can they take off? Even the office manager has to learn to delegate to the team. Do people know what their goals are, what numbers they're trying to achieve, and help our team rise to the highest levels of performance so that people walk in and know their jobs. And it's interesting, we have a client, the rookie in the practice on the team is 17 years. So this team knows exactly what they're doing. The surgeons come in, they do surgery, and they go home. The office manager does not really spend her day managing the team because they're so experienced. She manages improvement of the practice. She monitors the practice. She puts out any fires, and the team every person knows exactly what they need to do every day, and they get it done. So it's one of the most impressive practices I've seen. But it came about because of longevity that most practices don't automatically have and the right combination of people. So today, Grant, we're going to jump into the steps an office manager can take, starting with recruiting to build an outstanding team.
Awesome. What is step one?
Well, unfortunately, step one is recruiting because we have a staffing crisis in dentistry, just like we have in many industries. You hear, I'm in a CEO organization. I interact with CEOs of all kinds of businesses, and everybody's complaining about staffing and labor. And the biggest complaint is they can't, quote unquote, we can't get good people. Well, okay, stop complaining if you can't get good people. You got to build good people. So the first step is when you lose a team member, most dentists get very upset. It falls on doctors to interview. You're sitting there at 5 o'clock in the afternoon. Half the people don't even show up. Another half of the people that show up are awful. And the very good ones tell you this is like their fourth interview today, and others are offering to pay them more. So the office manager has to take over the team. This is not a doctor job or task. So before you get started with this, you need to write a fantastic job description, very detailed for the office manager. And one big section is human resources. Now, how does an office manager, I want to make sure we give a lot of practical information today. How does an office manager go about recruiting? Well, the first thing you can do is online advertising where appropriate. That can work very well on sites like Facebook and Instagram. Number two is to look at the online recruiting sites. Again, that's what I mean by online advertising. More than just social media where you can just put posts. I wouldn't advertise on social media. I would definitely advertise on the online sites like ZipRecruiter is one of the best out there right now. Indeed, may be the best one out there right now. Next year it could be different as these sites change positions. So that is a great start. Number two, you can ask your team if they know anybody and offer a bonus. And it has to be a significant bonus, maybe $1,500 if you hire a person that they recommend and the person stays for 90 days. Whether you terminate them or they leave, that would negate the bonus. That's another great opportunity. Recruiting firms can be good, but be careful because recruiting firms, again, they only can recruit who's out there. And there are a lot of weak candidates out there today, and they don't get paid unless you hire for the most part. So they're going to do their best to get you to hire somebody. Don't rely on them to do all the interviewing. You need to interview carefully, even if you use a recruiting firm. And remember, they've got the same challenges you do in the labor shortage. And then there are local posts of online sites like Nextdoor, where you can post that you're looking for a certain position. Many times people in the area know people who are looking for positions. And you might even mention in your advertising, whether it's full-time or part-time, what the benefits are. And one great step is a signing bonus that we're seeing today. If you get a really great candidate, being able to offer a signing bonus if they come on board. It used to only be for athletes, but it's getting more and more popular now in the business world as things have gotten competitive. One last quick thought for office managers on recruiting, and this is sort of a form of recruiting. You can recruit some of your own staff into new positions. So you might have an assistant who's seems really on the ball, really organized, that wants to move into administrative. It's a little harder to move administrative into assisting, but sometimes switching people up can also open positions and that position that you open might be easier to hire than the one that you just lost when you're recruiting or when you're trying to grow the practice as well. So that's the first step in recruiting for office managers.
All right, that's helpful. I mean, our practice uses a lot of, like you're saying, Indeed, and then it's a lot of interviewing lately. I mean, I don't know. I'm sure you're tracking stats and stuff, but it just seems like in the last couple of years, especially since COVID, there's just a huge shortage.
Mhm.
People come, oftentimes they'll say, "Okay, I'll sign up," and then they'll last a day or two or a week, and then they disappear. They claim they got a better offer. It's just kind of a weird time in the last, year or two. Any thoughts on that?
Oh, absolutely. Because remember, as a consulting firm, we depend on the team and we have to deal with this every client every day. So the first thing is COVID hit and we lost a huge number of dental staff that just, opted out. I only know the general practice numbers, but it's still interesting. We lost 10% of the dental hygienists from the profession, 6% of dental assistants, and that would include specialty practices. And nobody quite knows the front desk because nobody tracks that data. So, number one, we had a loss, and it's going to take at least 10 years or more to make up that loss. So it's not going to be an overnight solution. Number two, a lot of people in the world said, I'm not going to work in an office anymore. I'm going to work from home. I'm going to be a remote worker. So they're not even applying for these jobs. They're not going to consider coming into your practice, Grant, 1 day a week, 3 days a week. For the most part, there are a lot of people who got used to working at home during COVID.
Yeah.
So that those two factors really set us back. And third, huge competition. There are a lot of dental people who just left the profession to work in other industries because businesses will now hire people that are lesser qualified because they can't get qualified people. So that leads me to number two then for the office manager, because the office manager is there to save time and create freedom for the oral surgeon, but not waste her own time. Sometimes it's a him, could be a his or her time. So before you start scheduling interviews, which is what most doctors do, we're so excited that somebody called, do a telephone screening. And we have a checklist here. It's too long to go over, but we do a telephone interview, so to speak, first to see if the candidate themselves qualifies for the a live interview. And that can save you huge amounts of time when people are coming in. And we include questions about their minimum salary requirements. We include questions about, where are they working now? How long have they been there? We ask about experience and see if they check the boxes, and then we offer them a live interview. Now, having said that, both in the telephone screening and live interview that we'll get to, remember, office managers need to be selling the candidate on the practice. This is a two-way street today. And this is one of the biggest mistakes we make. We interview as if we're in charge of deciding if we're hiring this person. And of course we are, but we forget that we have to sell them on wanting to be in our practice. So we teach concepts like talk about the culture, talk about teamwork, talk about positivity, talk about upbeat people, talk about pitching in, talk about friendly practice, great customer service, and help the candidate feel like, wow, when they hang up, this is a practice I really hope will hire me. So in the telephone screening, you either knock the candidate out and don't bring them in, or you offer them a live interview, but all along the way, make sure you're selling them on how great your practice is so that they want to come to you. This is a two-way street. You're interviewing them, but they're also interviewing you.
Yeah. I love that point of the two-way street and making sure you're telling them all the good parts of the practice too. And I'm sure you're going to get to this too, but then probably the same thing when they come in for that live interview is everyone's being positive, explaining how great it is. Because I think too often, like you're saying, it's like, well, this is hard, and you really need to be really smart and do all these tasks, and it's very overwhelming. And then someone's like, I don't think I can do this, and no one, no one even pointed out why they would want to do it, you know?
Right. Well, remember I said, yeah, that's about one in every 500 candidates that will qualify for that today. Remember I said, once they come in, we've got to build them. But there are two things you have to do before the live interview, because we've really changed a lot of how we approach this since COVID. And we've been I want the listeners to know, we've been very successful with this, which means you can be too. So number one, you email the candidate that you offer a live interview to the job description. Grant, I can't tell you how many practices we meet that have no job descriptions, or they're, 500 years old. You need to be able to tell a candidate what the job is. And one of the first things an office manager should do when they enter an office management position is update all of the job descriptions, because it's almost silly to ask people to perform at a certain level when they don't really know what the job is. And a lot of people, I've said this for years, don't fully understand their job. And number two, and I'll explain why, check their references in advance. In the past, we would meet them. If we like them, we check references. Now, references in dentistry are funky because technically, and I'm going to just be very generalized here, the only thing most companies really should tell you legally is, yes, this person worked here, and no, they would not be qualified for rehire. You have to be very, very careful. And a lot of dentists will give you a really good, uh, reference on someone because they're scared to death to say anything negative, which I understand. We've been taught to be afraid of that. But at least check the references in advance, ask good questions. And the office manager does this. I can see the doctors. I can't see them, but if I could, they're sweating right now. I don't want to do any of this. This is the office manager's role. Remember, we're training your manager to run all human resources. But check those references and ask questions like, is there any reason you would not rehire this person? That's a great question. Did this person have any strengths that you really liked? Followed by, did they have any weaknesses that we should be prepared to work with. Now, some people still have jobs, so you can't check their references quite yet. But why am I recommending this? And let me jump ahead and then we'll go back. If you like the live interview, you need to hire them on the spot. In the past, Levin Group was very traditional, like many businesses, 3 interviews, your final candidates, decide which one you want, bring them back, make an offer. Can't do that anymore. Because if you wait that long, they're gone. They've got another job. And to what you said earlier, Grant, about the fact that, they'll leave after 2 weeks and take another job, it's because people are willing to pay more money. And
Yeah.
online has created this transparency where people can see exactly what's being offered. And if they're any good, they might go get that. So once again, we've got to sell them and keep reselling them on the practice. And when we get to onboarding them, I'll talk about what the office manager needs to be doing there.
Yeah, a couple questions with the checking references. And you mentioned having the office manager do this. Because I've had, other dentists, surgeons call me and say, "Hey, I see this person worked for you. How did it go?" I've called dentists about people I was going to hire. It just seems like sometimes when it's a practitioner to practitioner discussion, maybe more is said. Maybe it shouldn't be said, but things can get a little more real when you're like talking to another doctor. Any thoughts on that one?
No, that's a really good point. If you are willing to take the time, doctor, to call another doctor, that's the very best. But a lot of practices, Grant, and maybe this is what's influenced my thinking, they don't check references at all. They're so desperate to bring someone
Yeah.
in, they don't even bother to check the references. So if you won't check them, have your office manager do it.
Okay.
If the office manager says, "Hey, this sounds like a really good candidate, do you know Dr. So and so, whether you do or not, would you call them?" Then that's the office manager assigning the doctor to make that call. And I'm perfectly fine with that. And by the way, I'm not joking. The best references you'll ever get is from a practice where they found out that person was embezzling. So because they already fired them, but they want them gone.
Good
By the
point.
way, it sounds funny, but we've actually seen this where we found out, what happens is when we come in for management consulting, we're not accountants, but the numbers don't add up. And we have picked up many, many embezzlements, referred back to their accounting firm to evaluate. But there are times where we found out by accident that this is like the third office this happened in, and nobody was telling the next office because you got to be so careful what you say. So,
Yeah.
um, but for the most part, on a serious note, and well, that was serious, but on a day-to-day note, um, yeah, a doctor calling a doctor will be the best reference that you can get if the doctor's willing to make those calls.
Got it.
Yeah.
Nice. What's the next step here?
Okay, so the next step is the actual in-office interview. If you do a telephone screening and you like the person, and this all changed since COVID with the shortage, we recommend get the person in ASAP. Try to get them in. And again, doctors can't always do it, but office managers can. When they come in, greet them, ask them if they'd like a cup of coffee, a Coke, a Diet Coke. Treat them like a guest. You're not interviewing people any longer the way we used to. We are not, in fact, the truth is, we're not even in the driver's seat. They are. However, we want somebody who wants to be in our practice. And you need to sit down with them and in that interview, ask them questions. What do they like about working in oral surgery practice? What do they not like? We don't ask the negative questions, but we need to. It's an open, frank conversation, but the whole time telling them how this practice is fun, enjoyable, positive, great people. Hopefully it is, and that they would love joining this team, and letting them know along the way. Don't hold back that from what this conversation, the team would love meeting them. If and then listen, let the person talk, don't interrupt. And when sometimes one of the best questions doesn't sound like a question, or the words "tell me more." Keep them talking, listen to what they're saying. And then if you like them, be prepared to offer them the job right away. Don't send them home and call them 3 days later because it's likely they'll no longer be available. How do you know how to compensate? All right, number one, ask your colleagues. Ask doctors, what's the average assistant salary you're paying today? What's the average office manager salary? What's the average front desk? Very often with our new clients, those are some of the first questions we get. What should I be paying this person or that person? And of course, it's higher than it used to be. So we had a new client in early December who had just hired a team member, and he was complaining how much he was paying her. And then he said, I don't pay my other staff that much. And we said, you got to raise it, because when you hire a new person and pay them more than the people who are with you in the same positions, that's not going to go well. That's the fastest way to get them to look for other jobs. So he was unhappy with what he was paying to hire, and then found out he's got to bring everybody up. And by the way, what he didn't realize is that the new hire, her compensation was at the current level. We're not in a new normal. This is now the normal. We're not going, I've never seen staff salaries go backwards. And I don't see any surplus of staff coming in the country at this point. Another place to look is online. A lot of the online sites, the salaries are there, the benefits are there. Your staff is looking at it. You better be looking at it, and the office manager better be looking at it and know what the going rates are. And then you can think about this. It depends if this is a one-time situation, but if you've had a lot of turnover, you might want to start to think about something we came up with called longevity bonuses. 1, 3, 5, 10, 15, and 20-year bonuses. And they scale up. Each next longevity period, you get a higher bonus. It may sound like a lot of money, but the fact is it's very inexpensive compared to the cost of turnover. We estimate that a key turnover costs a practice in production anywhere from $50,000 to $100,000. So that's plus everything you have to go through. So a longevity bonus in some cases could be a great idea just to get some stability in place for the practice and the team. Because the longer your team's with you, typically the more effective and efficient they are. Now it's up to, again, different podcast in the future, but it's up to the office manager to make sure the team is well trained and highly efficient. I also suggest that you help the person understand that the practice is transparent, that her job is very important, and what the goals are of the job. So one of the things we do in management consulting, every staff member has at least one numerical goal of some type. So they really understand what they're doing and they feel good about goal achievement along the way. But make the practice sound fun and great and enjoyable. And if you're not that way, it's a different situation, but you want to move into that direction. Grant, what you said is the worst. Sitting down and saying, it's a hard job. We want a hard worker. Don't mislead the candidate, but don't tell them, put your frustration away. Nobody's going to take a job in a highly frustrated practice. And then the other thing that you might want to think about that I like is an annual staff team bonus, one giant goal. And if we hit it, everybody gets a bonus. People love that sort of thing. And they feel appreciated when they know there's a bonus opportunity and a chance to do better.
One question is, are there any red flags that you would counsel your people to look for when they are doing this live interview day? I mean, 'cause let's say you like them, they seem like a normal person. Is there anything that you would say, well, be careful if the answer to this question is that, or if they're saying a certain thing? I mean, what do you say with that?
Yeah. It's changed. So I have my own biases of how I would like it to be, but that doesn't really matter. So in the past, if somebody was changing jobs every few years, you did not hire them. You kind of can't do that today. You've got to hopefully bring people in that seem highly qualified and give them a reason to stay. Great environment, great culture, great compensation, whatever it may be. Number two, I would be very careful about people, and you can't really ask these questions, but people will give you information. People with young families and lots of kids sometimes end up with all kinds of complications of missing work, or if they're telling you they're taking care of elderly parents. I know this sounds like it shouldn't be it's a nice thing that they're doing, but when they're missing days in the office, not only is it harder, but the rest of the team has to work a lot harder and resents it. So you want people, if they're have stable home lives, if you get that sense, The way they talk. If they speak well, that's really important. When you have people who don't speak well, it's going to be difficult for them to create excellent customer service for patients. So, you'll, if they don't speak well, you'll pick it up right away. They don't need an SAT vocabulary. Nobody knows what those words mean anyway, but you want them, to be able to communicate well with people. Appearance, I think, is important. We live in a very varied world today. Casual dress. This is the new world. I understand that perfectly well. But if they look sloppy, if they look disheveled, if they look dirty, then that's going to translate to patients. And finally, did they show up on time? If they are late for the interview, and there's not a really good reason of some sort, because it does happen, cars do break down, things, it's hard to miss an address today with GPS. So that those days are those excuses are over. But if they show up 15 minutes late for an interview, I would really be concerned about that, and didn't call or text or some pretense. So what you really want is someone who comes in that you like. They're mature, they look nice, they sound nice, and they sound like they care. That's the other thing. Is this just a job to them until they find the next best thing? And we're in such a hurry to hire today, and I understand why, that we will accept candidates today that we would not have accepted in the past. So those would be my red flags. I'm a lot less worried about skill set. I think a lot of skill set can be taught, but organization, personal pride, punctuality, these are not things that can be taught.
Yeah, yeah, I would agree with that. Those are really
Yeah.
good points because I would much rather have someone who's on time and reliable and maybe has no experience than someone who shows up late, calls out all the time, but claims to have 20 years of oral surgery experience.
Yeah. And I'll say the next thing this way because legally we can't do this, but I'll make a generalized point. Even at Levin Group, our consulting firm years ago, um, I hired more mature people. And the reason I hired more mature people was twofold. One, they were more mature. They could handle situations. They were unflappable. They didn't get thrown all the time by anything that was happening. They knew how to work with different kinds of people. Life experience is a very powerful teacher. But the other reason was I learned early in my career I didn't want to be the training ground for a couple of years for people to go off and try to find better jobs. And by the way, I wasn't always going to another dental consulting firm. They would go into business because we are basically a business. We're just in dental. And if you have very young people and you bring them in and train them, it's not unthinkable that within a couple of years they might decide, I'm very skilled now, I'll go find a practice that will pay me a lot more, that's much more desperate for my skills. So I like maturity quite a bit. And I like people who have some life experience. They're easier to work with. They handle situations. They don't, we've all seen the team member just, absolutely lose it in the staff room because of what a patient said to them, as if it matters, versus, yeah, this patient had a bad day or maybe they're not a nice person. And so what? I'll move on to the next person. I'm not going to let it ruin my day and I'm not going to ruin everybody else's day over it. So maturity is a very calming, powerful aspect. And people who want a home versus I'll be here for a couple of years and then I'll go on to the next best thing. Yeah.
Yeah, I agree. I think maturity often it translates to reliability overall. I think
Hmm.
probably a little older people who are more experienced in the workforce. I think that's number one for me is they're showing up, they're on time. They may show up even if they have a cold, whereas some of the younger generation almost they look for an excuse not to show up. I think the main concern with maturity is like teachability. Can you teach someone your way of doing things when they've been doing it X amount of ways in the past at the same practice? That's always kind of a concern.
Well, that's one of the interview questions. And again, we can only do so much today, but are you open to learning new ideas?
Yeah.
Um, Now, in the past, every candidate would say yes, whether they were or not. What you don't want to do is hire someone, like you said, set in their ways, or the way I would say it is high levels of resistance. That you want people who understand that change is a constant, change will take place, and let's have fun doing it, not make it stressful. You don't want to add stress to your practice. And a bad hire will have a very negative effect on the team,
Yeah.
which is why my next suggestion. Now, Grant, I'm going to go out on a limb and say you're going to love this one, but you'll let me know. And you can tell me if you don't. I don't mind. But when you hire someone, the office manager, let's say it's you hire a female staff member, that's most of our staff. The office manager assigns a big sister. And what do I mean by that? And nobody does this. You bring this person in. I don't care if they have more experience than anyone else on your team, they get a big sister because when you bring in this new person, some of the team, they're human, automatically doesn't like them. They haven't even met them yet, but they don't like them. It doesn't matter who they are or
Yeah.
what they do. Like they're new, they don't fit our culture, they're not going to get it. And I've seen so many young, when I say young, I mean new candidates run off by the team.
Yeah.
So you assign a big sister, one of your, higher longevity people, and you say, if it's an assistant, make it an assistant. If it's front desk, make it front desk. This person's going to be your big sister for 6 months. You're very experienced. We're thrilled to add you to our team. It's not about your experience or skill set, but she's going to be there for any questions that you have. You got a question, you go to her. You've got a concern, you can always come to me. I'm the office manager, but she's going to be there with you. She's going to check in with you because we believe in the buddy system. And people generally love that. But here's the most important thing. It's not about the skill set because that's the office manager's role. Although the big sister would be glad to help, it's about getting the other team members on board. When you got the big sister, you don't even have to run interference. Usually everybody says, oh, okay, Julie has taken this new candidate under her wing. And it's an automatic response of liking the person versus an automatic response of they'll never be good enough for our practice. So
Yeah.
human nature is fascinating, but this big sister program has been outstanding. The place where it doesn't work, unfortunately, is when you hire an office manager because there is no one to be the big sister or big and there are men office managers out there or the big brother. They have to win everybody over as a good leader would do. And by the way, just quick, having nothing to do with today, the best thing a new office manager can do is sit down with every person, talk to them, ask them their philosophy, ask them for insights on the practice. If you engage them as colleagues more than I'm now in charge, you'll be accepted faster as an office manager. The toughest office manager transition is when it's a person who was on the staff already, was equal to other people, and now they're in charge. That's a tough one.
Yeah. I love it. I think it's a great idea because I think what you're pointing out here is that like when someone new, especially I would say an assistant, for example, surgical assistant comes in, the doctor and the manager are probably very motivated for this person to integrate, to have a great time. But oftentimes, kind of their peers, other surgical assistants, or if it's front desk, sometimes they feel a little threatened by the person. Sometimes they're very territorial and they're really, want everyone to mesh, and like you're saying, they just don't think that's going to happen with a new person, and it's like there's less motivation there sometimes for them to really make it work, and so yeah, like you're saying, it can kind of weed out the person unintentionally.
Well, just to make this even worse, sometimes the position's been open for a few weeks or longer. The rest of the team is working really hard. The new person comes in and they expect this person to pick up the slack instantly.
Yeah.
Here's the problem. Even if they're highly experienced, they're going to make mistakes. Well, what's a mistake in a new hire? Here's the definition of a mistake for a new hire. They didn't do it the way we do it. Okay. It's not a mistake. They're just bringing their background and experience and they haven't been taught how we do it. And the first time they don't do it the way we do it, they are horrible. They're evil. They're bad. They should get capital punishment. This is
Yep.
the worst hire in the entire world. And
Oh,
and I've seen staff members go to doctors after one or two mistakes and say, this person's never going to work out. So they want that person to come in and pick up the slack because they're tired, they're fatigued, they've been pushing. And the minute they don't do it exactly the right way, oh my gosh, it's just the end of the world there. But let me add one great idea in here. This is another one I hope you're going to love. The office manager, and doctors should participate a little bit, should tell the candidate, we want you to be successful. I am here to support you. And for the first 6 months, every week or two, we're going to sit down for just 5 or 10 minutes, and I just want to check in with you. It's not a performance review. You know from past podcasts, Grant, I'm not a big performance review fan anyway, the way they're done. But having said that, it's just like, how's it going? What are you seeing? And also, what ideas might they have from wherever they came from that would be interesting? So, don't just bring them in, put them to work and hope it goes well, but meet with them in a supportive, caring way to help them be successful. And I think that's one of the best ideas for an office manager. You develop your relationship, you get to know them better, but they know you're really in their corner. You're really there to help them and make it work in the best way. So that's one more suggestion that I would give when you're onboarding people, so that they're not just thrown into, normally we hire them, put them to work, and then keep telling what they're doing wrong.
Yes,
And that's not the way to do it.
completely. Love it. I think it's so important to check in on them, make sure they know you're there. You really got to change the whole culture, like you're saying, about being hard on people. I mean, one thing I do, like from the beginning, I'm kind of telling my assistants, our managers, everyone, hey, it takes, and I try to put a time stamp on it, like it takes a good 6 months to create a great oral surgery surgical assistant.
Right.
Because if not, after a week, a month, they'll be like, they're not getting it. They're just too stupid. Fire them. So annoying.
Right. Right. And then when you fire them, they're complaining that you haven't hired anybody. So
Exactly.
you can't win that one. I think it takes 6 months for just about anybody to indoctrinate themselves into the practice. It's funny, you and I use that same benchmark of 6 months. I mean, you can bring in the greatest assistant in oral surgery. It still takes time to fit into the culture, to develop relationships with people. And then there's some people you hire that their attitude is, I've done this before. I know better than you guys do. And again, you have to work. It's not all bad, but you have to work through it so they don't alienate everybody else around you. My last comment would be that if the office manager does get to meet people that they don't hire, but they really like, keep that logged in, because you never know when you might need to go back and reach out to people in recruiting and offer them, the opportunity for another interview 6 months, 12 months, 2 years down the road. And practices don't think that way. We hire as if every candidate's going to stay for life. I think turnover in dentistry will be at a faster pace than ever before for a long time to come. And for everybody listening who's like, oh my God, this is terrible. And you're right. It's a lot easier when we have great longevity. Get your systems in place. When you have great systems, you can bring people in and train them quickly. Now, that's another major component of the office manager job. But when we did our research for our new office manager mastery program, because there's just so little education out there for office managers, we found that office managers weren't really upgrading the systems regularly. They were just trying to get through the day like everybody else. And that's why you need highly trained office managers and why we're doing these podcasts.
Yeah. This has been a great discussion for me. I mean, two take-home messages personally that I'm getting from all this. One, I feel like I need to be a lot more positive and welcoming when the person comes in for that live interview day. Especially because if you're like going a while and you're just several people coming in and shadowing, I think sometimes it can be there's a tendency there to think they're probably not even going to join. I'm not even, going to pay much attention, just have my manager walk them around, maybe look in a procedure. But until they join my practice, I'm not going to put much effort. And I think that that's probably not a good idea because that this person is probably thinking, am I going to get along with this doctor? Are they nice? Are they friendly? And they want to see that on that live interview day.
Grant, I'll give you one suggestion. And I'm dead serious about this. And I would be doing this absolutely today. Every candidate that comes in leaves with a bottle of wine in a nice little wine bag with a ribbon. Even if you don't hire them, no matter who it is, you get $20 bottles of wine. Riojas are very good wines at $20 out there. And you put it in a nice wine bag, and whoever came in We give them the feeling, the positivity, the respect that I'm glad you came in, even if we're not going to hire them.
Yeah.
And not only is it a nice thing to do, but the candidate you want, what a nice feeling by them, to know that this nobody's ever done this for them in their life before. What we
Hmm.
forget is they hate interviewing. Nobody likes interviewing. It's not
Oh yeah.
fun to do
Terrible.
it. Right. They're out there, they're going places they don't know to talk to people they've never met to see if maybe they'll be offered a job. And everybody leaves. The worst interviewee leaves with a bottle of wine in a very nice looking wine bag. Because the two highest value gifts that are not very expensive are books and bottles of wine. Everybody feels great about that. Now, there are people who don't drink, and I haven't figured out what to do about that. But just because they don't drink, somebody else in their family might. Or if you're in a community where drinking is pretty much not part of the community, get a box of chocolates. But don't make an excuse of, well, people in our community don't drink alcohol. Then find something else. Make people
Yeah.
feel great.
Yep. Love it. The other thing too I take away from this is because we do assign, like you're saying, like a big sister to teach and help the person, but I feel like I need to be more involved with that and kind of checking in and almost asking that big sister person, how can I help? What can we do together? Because sometimes I think there's a tendency from the doctor to be like, all right, this is your job. Your job's to train them. And if the assistant's not learning it quick enough, you're like yelling at the big sister person, like, what the deal? This person is horrible, And it's been 2 weeks. They should know everything already.
It's funny. I was talking to one of our clients, and these are doctors. So let's just go to the doctor level for a minute. And he was complaining about this new associate who was young and not experienced. And I finally said to him, because I know the guy really well, so I could say this. I said, by the way, what were you like at that stage of your career? I remember when I joined my father as a general dentist. He said, take the first 6 months and go slow. Because as I joke, my license didn't say dentist, my license said slow dentist. And 6 months later, you get a license that says a little bit faster dentist. But my
Yeah.
point is that there's something called doctor power. You and I've never talked about this. That's my term, that the highest impact you can ever have is the doctor. And what do I mean by that? If you have a referral and you thank the referral source as a doctor, whether you text or call, that's better than somebody telling just the front desk. If you call a patient at night, it's great if you have your assistants call, but if a doctor calls, much higher power. And if you check in with your new team members and show that you care, which I think is so critically important, and it does take a little bit of time, but it's so worthwhile for people who come to work every day, they work hard to make you successful. That's doctor power. And even though the office manager should do 95% of it and will, and that's the way it should be, yeah, doctors should not, they should delegate, not abdicate, is the way I like to say it. So just
Yeah.
taking that extra time. This wasn't in dental, it was legal, but they were recruiting a friend of mine many years ago who was a top attorney. And they really wanted him to be in this firm. And he went on to be an absolute superstar nationally. But when they were recruiting him, before he made his decision, a bouquet of roses showed up at his house for his wife. And the note says, we just want you to know how impressed we are with your husband. Now, I'm not saying we should necessarily do that. I mean, I might do it. I like stuff like that. But it's the soft side that so often makes the difference for people and how they feel. So
Yeah.
your point of spending a little bit of time with them, they love it. They want your attention. Every staff member wants your attention. And if you give it to them, it's a great reward to them. It's greatly appreciated and it builds great relationships.
Yeah. And I just can't over highlight your statement about the two-way street idea. For example, yesterday I had a potential associate surgeon fly into town and spend the day with me just shadowing to get a feel for the office. And I was thinking back on when I had done this and when I'd done externships to look at programs. And I mean, I just kept thanking him, thanks you for coming. I said multiple times, we all hate like shadowing. It just sucks to stand there and
Right.
watch. We're surgeons, right? It just seems so stupid not to be the one cutting when you know what you're doing. And he's, oh yeah, it's okay. And I, I tried to use it less of a job interview and more of like how do you do things and what do you think about this way I'm doing and is there anything you
Yeah.
can learn from what I'm doing here and I'm gonna want to learn from you and I turned it more into at the end of the day, I hope this was a learning experience. If we don't come to any business agreement, at least this was a fruitful day for you and your career to learn something different by watching me. And I think he really appreciated that. It was like, oh, this is cool. This is better than just us checking each other out, and if we're not financially compatible, then we part our ways. So there's got to be something like that, right, to make it more than just a business transaction.
Yeah, the best relationships are two-way. I heard a wonderful quote years ago from an absolute brilliant person. And he said, the best relationship is when the other party thinks they're getting more out of the relationship. So if you and I were doing something, Grant, and you thought you were getting more from me, and I at the same time thought I was getting more from you, that's a great relationship. Treat your team that way. Treat your team as colleagues. Don't treat them as also-rans. And what's happening is now that we're training office managers in our new mastery program, we're finding they're doing better hiring. They're doing better onboarding. And the reason is they're not just checking the boxes and saying, okay, this person has a pulse, I'll hire them, or this person has 5 years of oral surgery experience, I'll hire them. They're onboarding them into a culture and not just hiring a body to come in and do a job. And I think it's going to pay off over and over and over. We'll still have turnover, we'll still have change, but the rest of that office manager job is to make the office so systemized that any person of qualification can come in and fit right in. And that's great. But we've hit on some wonderful points today.
Yeah.
And it's all about my attitude is if I hire somebody, it's now my obligation to help them be successful. I attend every Monday national consultants meeting that we have, unless I'm, unable to do it. I don't. We have a vice president of consulting. I don't say, okay, you handle it. She runs the meeting, but I'm there. I'm making comments, congratulating, adding insights, because I want everyone to know I'm part of it, but I also want them to know I care about helping them do a great job. And every consultant we have, for example, knows they can call me anytime for any reason. Now, you really want your team going first to the office manager, but the doctor is still the major leader, no matter how we cut it, because they're the doctor.
Yep.
Yeah.
Well, I love this. I thank you for sharing this content with us and walking us through what it looks like here to recruit someone, to integrate them into your team, to train them. This is just valuable, really valuable stuff. So thank you.
Yeah. And our next one will be on meetings and agendas and results for office managers.
Looking forward to it. It's going to be
All right.
fantastic.
All right. Thank you, Grant. And
Thanks, Roger.
Happy New Year. And I know this is coming out in 2026, so you're not supposed to normally give dates, but either way, I hope it's the best year you have ever. I hope it's a great year for everybody.
Same to you. Thank you so much.
Okay.
Talk to you later.
Bye.
Bye. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.